Over the years, resistance training has moved from being a male-dominated exercise method to a vital part of fitness for everyone, and today we'll look at how it benefits women, the physiological considerations specific to female athletes, and key aspects of safe, effective programming. Women who regularly participate in resistance training experience a host of health benefits. This includes improvements in overall fitness, reduced risks of degenerative diseases like osteoporosis, lower injury rates, and enhanced sports performance. Although some women may have historically questioned the value of resistance training due to societal perceptions, today's evidence clearly shows that women are well suited to resistance training and can adapt well to its stresses. To optimize both health and performance and to minimize injury risk, resistance training is now seen as an essential component of any female athlete's fitness program. Researchers like Dr. Staron and Dr. Feigenbaum strongly recommend incorporating resistance training into women's routines to help them achieve these benefits. When designing programs for female athletes, strength and conditioning professionals must understand key differences in physiology, body composition, and performance responses between men and women. Before puberty, there are essentially no differences in height, weight, or body size between boys and girls. As puberty progresses, hormonal changes cause these differences to emerge. In girls, increased estrogen levels lead to higher fat deposition and breast development, while testosterone in boys promotes bone formation and muscle protein synthesis. This extended growth period for boys results in greater overall adult stature and, on average, a higher muscle-to-fat ratio compared to adult women. Women typically have more body fat, less muscle, and lower bone mineral density than men, and they also tend to be lighter in total body weight. Notably, men usually have broader shoulders relative to their hips, providing a mechanical advantage for shoulder-related muscle functions. By contrast, women generally have broader hips relative to their waist and shoulders, which affects their biomechanics in various exercises. Sex-related differences in strength and power output are significant, though they vary by measurement method. In absolute terms, women typically have about 2/3 the strength of men, with lower body strength in women being closer to male values than upper body strength. This difference is partly explained by the distribution of fat-free mass. Women have less muscle mass in the upper body, which impacts their strength output in these areas. However, when strength is measured relative to fat-free mass or muscle cross-sectional area, the gap between men and women narrows significantly. Research by Dr. Häkkinen and Dr. Comey demonstrates that muscle quality, meaning peak force per cross-sectional area, is not inherently different between men and women. However, men tend to have larger muscle fibers, which contributes to the difference in strength. Importantly, there is considerable variation within each sex, and sometimes the difference between two individuals of the same sex can be greater than the average difference between men and women. Strength and conditioning professionals should keep this in mind, as individual abilities can vary widely, requiring personalized program adjustments. Similar to strength, power output also varies between men and women. Studies by researchers like Dr. Harman have shown that power output in women measured during lifting exercises like the snatch and clean is about 63% of men's when adjusted for total body weight. Vertical jump and standing long jump scores, which reflect power output, also tend to be lower in women. When these outputs are adjusted relative to fat-free mass, the difference differences shrink but do not disappear entirely, suggesting that neuromuscular factors may contribute to the observed power gap. Despite these physiological differences, women respond to resistance training in ways similar to men. Studies show that women can increase their strength at the same rate as men or even faster in relative terms. So, Dr. Miller's research points out that although men may see greater absolute strength gains due to larger baseline muscle mass, women often achieve comparable percentage increases in strength. Nervous system adaptations are a primary driver of strength development in both sexes, although hypertrophic factors also play a role. Dr. Sterin and Dr. Hagerman's studies using advanced imaging techniques like computed tomography reveal that muscle hypertrophy in women following a high volume or high intensity training can be similar to that in men. This observation is evident in the muscular development of female weightlifters and track athletes who often achieve impressive muscle gains without anabolic steroids. Although the magnitude of hypertrophy is typically lower than in males, women with relatively higher testosterone levels or favorable genetics may experience greater muscle growth and strength. Strength and conditioning professionals working with female athletes must also be aware of the risks associated with the female athlete triad. This triad refers to the interrelationships between energy availability, menstrual function, and bone mineral density. Female athletes who train intensely without consuming enough calories may enter a state of low energy availability, which can lead to osteoporosis and menstrual irregularities, including amenorrhea, the absence of menstrual cycles. Amenorrhea results from decreased secretion of luteinizing hormone, impacting various bodily functions and increasing the risk of stress fractures, endocrine disruptions, and reduced performance. Resistance training, however, can help mitigate some of these risks by promoting bone health and encouraging appropriate skeletal remodeling. Higher intensities of resistance training have been shown to enhance bone density, particularly when started in pre-adolescence. Ensuring adequate nutrition is essential to prevent the triad. Strength and conditioning professionals should work closely with registered dietitians to assess and support athletes' dietary needs, especially for nutrients like calcium, vitamin D, and protein. Female athletes, particularly those in sports emphasizing aesthetics or weight categories, may be at higher risk of disordered eating. These individuals should receive guidance from medical and dietary professionals to safeguard their health. When designing resistance training programs for female athletes, professionals should focus on fostering a balanced approach that supports muscle strength, bone density, and overall well-being. Resistance training offers numerous benefits for women, including counteracting age-related declines in bone mineral density, reducing injury risk, and enhancing performance in sports and daily life. In programming, it's important to include complex multi-joint exercises like squats, cleans, and snatches, as these movements encourage neural adaptations and functional strength gains. Research by Dr. Sale shows that women, like men, benefit from high volume or high intensity training over time. The emphasis should be on progression and ensuring proper technique before increasing loads, as neuromuscular adaptation periods can vary individually. Finally, creating a positive training environment for female athletes is crucial. Programs should educate athletes on the benefits of resistance training, dispel myths around muscle gain and femininity, and focus on personal progress rather than comparison. By understanding the unique physiology of female athletes and the specific risks they face, strength and conditioning professionals can better support women in achieving their health and performance goals. When it comes to muscle physiology, men and women are remarkably similar. This means there is no inherent reason to design fundamentally different resistance training programs based on sex. In fact, because the same muscle groups are involved in sports and physical activities for both men and women, the training focus should be on strengthening the muscles needed for success in a particular sport, regardless of the athlete's sex. The main difference between men's and women's programs typically lies in the absolute amount of resistance used, which varies based on individual strength levels. For young female athletes, regular participation in resistance training is essential to help them reach their genetic potential in strength and power. Observations of elite female athletes show what is possible. Top female gymnasts, for example, can perform 40 pull-ups, and competitive weightlifters can clean and jerk more than twice their body weight. These feats underscore that women with the right training can achieve incredible levels of strength and power. One area where female athletes often need extra attention is in upper body strength development. Studies show that women generally have less absolute upper body strength compared to men, which can be a limitation in sports requiring powerful upper body movements. For women who play sports like volleyball, basketball, or track and field, emphasizing upper body exercises can make a significant difference in performance. Adding one or two extra upper body exercises or additional sets can be beneficial, especially for women who find multi-joint free weight exercises like snatches and cleans challenging due to upper body limitations. Weightlifting movements like cleans and snatches can also support general athletic performance because they engage large muscle groups and improve overall strength. Additionally, these exercises have a relatively high caloric cost, which can help athletes maintain a healthy body composition while training. Another critical consideration in program design for female athletes is reducing the risk of knee injuries, particularly tears of the anterior cruciate ligament or ACL. Studies indicate that female athletes are 6 times more likely than males to experience ACL injuries in sports involving sudden stops, pivots, or jumps, such as soccer and basketball. It is estimated that over 15,000 severe knee injuries occur in female college athletes each year in the United States alone. While the increase in injuries may partly reflect greater female participation in organized sports, other factors are likely at play. Researchers point to multiple potential causes for this higher injury rate, including joint laxity, limb alignment, ligament size, body movement patterns, and hormonal fluctuations. However, the most significant contributing factor appears to be neuromuscular deficiency that leads to improper biomechanics, specifically an increased dynamic knee valgus upon landing or pivoting. This inward collapse of the knee is a common risk factor for ACL injuries in female athletes. To counteract these risks, researchers like Dr. Hewitt recommend that female athletes participate in conditioning programs, ideally beginning before puberty, to build a foundation of neuromuscular control. Conditioning programs should be balanced and include resistance training, plyometrics, plyometrics, agility, and balance exercises, all of which can strengthen the muscles and connective tissues around the knee joint and improve knee stability. The majority of ACL injuries in female athletes result from non-contact movements like deceleration or pivoting, which means that building control and strength in these areas can significantly reduce injury risk. Beyond strength and conditioning, nutrition plays a key role in supporting training adaptations and preventing injuries. Female athletes should focus on consuming adequate calories, including sufficient protein and healthy fats to fuel training and support recovery. Proper nutrition is especially important for athletes in energy-demanding sports. Those who fail to meet their caloric needs risk not only undermining their performance, but also facing issues like the female athlete triad, which can impact menstrual function, bone density, and overall health. When designing programs, it's essential that strength and conditioning professionals work with dietitians or nutritionists to ensure female athletes are consuming enough nutrients to support their physical demands. This is particularly important for preventing injuries like ACL tears, as a well-nourished athlete is more likely to achieve full training adaptations and maintain muscle and bone strength. In summary, effective resistance training programs for female athletes should be rooted in the same principles used for male athletes, with specific attention to upper body strength and injury prevention. By including additional upper body exercises, focusing on knee stability, and emphasizing the importance of nutrition, strength and conditioning professionals can create training routines that optimize female athletes' performance and longevity in their sports.